Pratik, we are live. You can start.
So good evening, friends and colleagues, ladies and gentlemen, and everybody who is viewing us live from Facebook. A very good evening to all the viewers. I am Dr. Pratik Bam. I am a postgraduate student, prosthodontics, and I'm Public Relations Head, Team Cynodent International. And I'm hosting this session along with Dr. Anu Vashish ma'am. Dr. Anu Vashish is membership in charge, Team Cynodent. I heartily welcome all of you today for this exclusive webinar. It is my hearty pleasure to welcome you all. I would also like to thank our founder and CEO, Team Cynodent, Dr. Anmol Bagaria, for organizing this webinar. Cynodent is global healthcare for all. Cynodent brings to you Cynodent International and Cynodent India. Cynodent is a unique digital healthcare platform for the first time in India. Revolutionary changes brought in India by bringing a digital healthcare platform that will provide and enhance a good relationship between the patients and the doctors, and also enable a real-time appointment scheduling system. Our goal to create easy and fast access to healthcare services. Cynodent is here to create precious smiles on our patients' faces with minimum effort and maximum welfare. Cynodent International has brought for you research cell, blog sections, and education programs for doctors to enhance their knowledge and clinical skills and keep them updated regarding the same. Recent advances and latest treatments, and also the developments. We are currently doing free webinars for the students, dentists, senior practitioners, and other colleagues from India as well as across the globe, which are from different webinar era going on. We also design papers, mock tests, and send latest textbook to the budding dentist. We are trying to bring globally historic changes by uplifting our honorable profession more and more every day. Cynodent is also working for social welfare and humanity to enhance the quality of life by providing healthcare needs, health awareness, and free treatments. So I'm very glad to have all of you with us, and I hope you're excited for this session. So the topic for today's session is your successful steps towards your DDS admissions and your MDS completion. So our speaker for today's session is none other than Dr. Suresh Shenvi sir. Dr. Suresh Shenvi sir is currently working as faculty in VK Institute of Dental Sciences, KLE University, Belgaum, in the Department of Conservative Dentistry and Endodontics since 2012. He is also a national speaker for endodontics and a career guidance at various platforms like IACDE, IDA, FAMDent, World Dental Show, and has conducted over 50 CD programs at national and international level. He is the co-author for Dentist by Dr. Gauri Shankar, Dental Bites, which are few of the best-selling entrance examination books in India for MDS entrance exam. He has also cleared NBDE in just 23 days, ADAT for dentistry in USA, and Dubai endodontic specialty exam. He is the key opinion leader for Oricam Healthcare India. He is also the recipient of the Best Teacher Award by KLE University for this institute for the year 2018 and 19. He also owns a popular channel named Aspire 32 on YouTube. It is my hearty pleasure and honor to have you for this webinar, sir. Over to you, Suresh, sir.
Thank you so much, Dr. Pratik and Dr. Anmol, Dr. Anu. It has been a pleasure to be a part of this initiative, and I've been following Cynodent from so many months, and so many good podcasts, even international speakers who have been, especially on endo. I have definitely seen all those podcasts. Thank you so much once again, and it's a pleasure to meet such a young team, and I hope today's session will be helpful to you. I just want to share my PPT for the, yeah. So let me first share the NBD which we are going to cover. I hope my slides are visible and they are moving.
Sir, it's visible. You can start the slideshow from the first slide.
Okay, fine. So I always keep this slide, welcome back to school, because I was maybe super young at a time, and I thought my education was finished after my MDS. But over a period of time, I realized that learning never stops. and you can always have different goals in your life. And many times it may be for many reasons, maybe for financial, or maybe you are stuck at a place after your education and you want to move ahead. So that's always important to have a goal. And if you are a young undergraduate student or even postgraduate student who feels amazing after completion of their undergraduation, we all remember these amazing days where we come into the internship and we no longer are under stress of our teachers that देखेंगे क्या होता है, अब तो हम intern हैं. So that is the same situation. It's a wonderful achievement, and it's not a small achievement to finish your graduation or your post-graduation. But it has been truly said that the happiness of achieving something or the significance of achieving something is always, reduces once you achieve it. And that's why the graph of happiness of achievement always goes down if you don't have a goal in your life. And I have been in this situation, at multiple stages of my life, at undergraduation, at post-graduation, at US exams, at Middle East exams. And today I'm here to share one such experience, which I really feel that it changed my perspective about my country. And it gave me a broader vision about how many goals one can achieve, no matter how insignificant you may feel at one moment, or you may be from any place of your in India. And there is always a confusion between India and US for dentistry. And this is a very nice joke which we often I don't know whether it is reality or wrong, because earning money in medical and dentistry is very difficult in India, because it is not just about degree in our country. It is majority time. It is more about building your name and reputation and trust with the patient. So especially in current generation, when there is MDS fees is so high for private education, so it is normal that a student will ask, what are the other options which I have, which I can maybe think of if I have to put a greater amount of money. So there is always a confusion in youngsters whether they should go for an MDS and DDS. Although I speak on how to succeed in entrance exam too, but today I'm only covering the DDS here, and I will also be sharing my experience in a smaller way, that if you are already in post-graduation, how you can do the post-graduation more meaningful so that it becomes a life-changing experience. I know US and Canada is also another confusion now, because Canada is very good for migration. And although I won't be speaking much about it, but if you have any questions, I can always answer. But one question is always asked, which everybody wants to know, that why dentistry in USA? Because it is even today the best branch to practice. It is one of the branch where everybody competes to reach in foreign in the US, because it is an highest paid, at least paid a lot even compared to the Indian scenario. And because we know that there is dollar rupee difference, so if you have made a lot of money in dentistry in US, and it is especially the amount of work and life balance what you get in United States, you are not always running around. But it also depends whether you like running around. There are people who want to be busy in life. There are people who want a balance. And if you want a balance and more financial gain, then dentistry in USA can definitely be an option. So that is what we are going to learn today. And what I'm going to cover here, it is the DentPin, ECE, NPDE, ADAT, CV. So I'll be covering it briefly because we have less time, and I won't be able to cover everything in this webinar, but I will definitely give you an idea. Now, important thing to remember here is that your NBD exam is a eligibility exam. It is not admission to DDS. It is a requirement. That means unless you clear the NBDE exam, you will not be able to apply for the DDS admission in USA. So one thing is very clear. Majority of the time, you have to do a 2-year degree course, either a DDS or a residency. And for majority of these two courses, which are minimum 2 years, you have to give NBDE exam. And now it is called as INBDE, which we'll discuss. And this is conducted by an authority called as Joint Commission of National Dental Examination. So this should be very clear with you. And please note that although I have been in touch with many students and I try to present the latest information, but you have to do your own research before you accept the information which I'm sharing with you today, so that there is no confusion. So the process is very simple, which you can do on your own. You don't have to spend a lakhs together to apply to this admission process of United States. And the process starts with the DENPIN, and then you have to apply something called as ECE, and then you have to book the exam date, book the flight ticket, apply for visa. Okay, so these are the basic steps for going to United States, even before you think about the admission. Admission is a very separate aspect, but you have to fulfill the minimum requirements. So DENPIN is a very simple number. It is like an Aadhaar number in our India. So all your information is linked under DENPIN. It is a must for an international student. It's very simple. You have to go to this site, create your username, password, and give your details, your name, what is matched with your documents, official documents. And the second step comes is the educational credential evaluator. There are different credential evaluators. EC is one of the thing which is mandatory in majority of the dental schools, and the NBD authority also asks for EC. Now, what is EC? EC is basically, it converts your Indian scores, because we are from a international category and our degree is not recognized by the United States Dental Board, but we have finished the dentistry. So they want to make sure that we are eligible to appear or take admission in the international admission category of the DDS. So DDS is actually 4 years, but we applied to something called as advanced standing program, which is specifically for international students, which is a 2-year program compared to 4-year program. And international means it is for everyone. Although we know that Indians are everywhere, but it is open for everyone. So there is a competition, but the competition is less because you are not competing with US citizens. So, but they want to make sure that your degree is valid. So you have to send all these certificates to them. It costs around $160 to $200, roughly around 20,000-25,000. It keeps changing depending on whether you are applying for a rush service. Now, please note that this has a validity of 5 years. Earlier, it was 10 years. Now it has 5 years. So if you are not sure that you are giving the exam or applying for the exam, don't get ECE done, because it will be required at multiple steps. And if your validity gets over, then you will have to again get the ECE application process. So process is very simple. Go to ECE, select individual account, select course by course evaluation. There are different types of evaluation. We want course by course. That means for them, first BDS, second BDS, third BDS is a course. Each year is a course. Like for example, conservative dentistry is a course. That is how it is taught in United States. Now that change is also coming, at least in our university also. This is in discussion, but DCI doesn't allow it. But in foreign countries, it is course by course. And that is what you want to get it done. Earlier, it was very difficult for me to understand what is this course by course, but you should remember it now. And once you fill the detail, you take the printout, then you put that envelope, that document, along with the attested copies of all these documents. Your university already knows how to give the document. There is a sealed envelope, signature, transcript, everything you have to send. Make sure you send one copy. There is an option to send it. one copy digitally has to be sent to JCNED. This is very important because they will take the documents from this document from you, and they will make sure that you are eligible for the course, the NBD examination. That's an eligibility examination. So unless you have, unless the JCND gets your EC report, you will not be able to appear for the exam. Please remember that. Okay, so you have to send it. If you by chance you miss it, which I did, if they have not posted the documents to you, you can always send an email and you can request them that one document go to JCND, because see, in future also you have to again send the same document to multiple schools. So here you have to send the information to the JCND also. Please remember that. Okay, this is a sample report for EC, and you get the score, that is grade average out of 4, and your score, if it is more than 3, it is always beneficial. Even though if your score is less than 3, the chances of admission slightly decreases, but if your CV is really good, you can get the admission. Now I had around 3.83 for my BDS and I think 3.1. Now one thing you have to remember is if you have scored 50%, that doesn't mean you will get 2 out of 4 in the EC. That is not how it works. Okay, so I also don't know the exact way of preparing this, but please remember that. So once the JCND gets the information, they will send you an email. They already have the information because you have given the information in the dent pin. So they correlate and they send you an email saying that now you are eligible to get the NBDE and in a category that is graduate of a non-accredited dental school. This is very important because we belong to a non-recognized college. That is what it says, and you have to get used to this terminology because this will be asked in many application forms. That is graduate of a non-accredited dental school. So what is the next step? Next step is you have to know that now it is integrated national board dental examination. If you have already appeared for NBD part 1, you have another 2 years to appear for part 2. But for someone who has already finished NBDE, you have to go for the INBD. And trust me, people used to take 6 to 8 months for part 1, 6 to 8 months for part 2, on an average 1 year. But now you have to appear together. So it is more challenging. It is more difficult. Already, all the countries have already made things difficult for Indian students. So, or maybe majority of the international students. But if it is still possible, if you really work hard. Okay. So, but I will just try to explain everything so that you can understand it better. So what is part 2? It's very simple. The application form, you have to go to NBD part 1 in this website. Okay, they already have the information. It is combined with the dent pin. And here you have to make the payment. Once you do the payment, they approve your application. It is shown as active. And you get a reference number, which is very important because the JCND just validates your application process. They do not conduct the exam. They outsource it to the various exam centers, and which we'll discuss. So earlier it was part 1, part 2, the fees was almost $1,100. So it is around 70 to 80,000. Okay, quite a big amount, at least for a middle class people, who at least I had to put so much of my savings because I was a beginning of my settlement of my career, and it's a big amount because the cost of travel also adds up, and there is so much of stress along with this. So the exam is conducted by the Prometric, which is there all over the world. But please remember, the NBD, you can only appear in US and Canada. You cannot appear anywhere else. So Prometric centers, you have to go, you have to select the sponsor as American Dental Association, then select INBD or NBD part 1, part 2. These are the requirements, especially the ID requirements are very important. And they follow all this information strictly. Okay, and you should be thorough with all these rules. It is not like our country You cannot say that I will show you the photo, I have Xerox copy. They will not accept it. Nobody entertains our explanation in foreign countries. You have to follow the rules, and there should not be any mistake, because you are cross the ocean, and if you have done a mistake, you cannot come back in 1 or 2 years and get the things done, right? It is a long journey to reach United States. So once you go to JCND, you can pre-select, you can select which place you want to go, what is the time slot available. It is conducted throughout the year, and all the question papers are different for every student. Okay. And better suggestion would be, you first see where is your family located, because staying in US is very expensive. I had a very good friend, Dr. Ankita, who helped me to stay there with their family, and Dr. Aman, both welcomed me there. And because of that, I was able to stay there for 23 days, in which I appeared for part 1 and part 2. Then again, I went for the ADAT. So I'm thankful for having to, that they helped me. So you will also find your friends, which can save you a lot of money if you don't have anyone there. So what is next? The major thing is visa. And you know that before uh, Mr. Modi becoming our prime minister, even his visa get rejected. So you may have an excellent score, you may have, a lot of financial stability, but there is always a law, difficulty in getting visa. It depends on their discretion. The documents are very simple. You can take help of an agent, or you can do it on your own. These are the steps, and it happens for 2 days. There are different types of visa. For exam, you just need the student visa. You don't need the F1 visa, which is after your admission. Okay. On a student visa, you can just go there and give exam or travel. You are not supposed to work. So if the the visa fees is around 11,000-12,000 rupees, and these are the documents. They are, when you fill your visa application, they already know everything about you. So when you go to the consular, which happens in India, they specifically ask you what is the purpose of visit, who is sponsoring your trip, whether you are married or single, and what are your travel dates. They are only concerned about you, whether you will come back for that moment. Okay. So purpose of visit, at least my brother told me that you should be always genuine to them. So I told them exam. My finances was self-sponsor. If you are a student, not yet settled down, you can always, parents can sponsor it. And if you are married, you are lucky in this situation, because they know that, you will not go and marry someone else there for a citizenship. So they readily give you visa. And travel dates, they already know that, okay, you are coming back. So you don't give them a big story that I'm going to settle down visa. Never say, US, never say all those things, because you are just going to give visa. You are even not sure whether you will clear the exam, you will get the admission. Generally, multiple entries given. Please note, if you lose the passport, your visa interview has to be taken again. You cannot show the Xerox copy of the visa. So let us go to United States. But the problem is, we have not studied, and that is what we want to cover. Earlier part 1 used to cover the basics, although we are aware about this physiology, biochemistry, but it is the ethics which is new for all of us. And these are the books. I still feel Dental Dex is a very good book to gain the knowledge, to get a start. And if you want point by point information, you can always read the first aid. They tend to ask more about dental anatomy. The exams are very interesting. It was a very good experience when I was learning in, for the exam, because it is not about remembering. It is about whether you have understood the concept. And that's the beauty of this exam. You should give this exam. That is how the exam should be in all the countries. But we are different than the United States. We have so much of competition. So it is more of a memory based. And now things are changing. As far as the NBD part 1, that time it was considered that, for example, We don't learn about lung system. We don't learn about the physiology in depth. We don't try to understand the concept. And that is when I came across a channel called as Khan Academy, which was very good. You should go through it. There are so many channels in United States, in YouTube, which can even teach you better than what we all teach or learn in our dental school, at least theoretical, because teachers are different. You may learn better with one way of learning than the other way of learning. So then I started my Aspire 32 YouTube channel, where I make videos for the students, and it is almost 23,000 subscribers. So I will share you the information later. Then the NBD part 2 was more of a clinical. It included pharmacology. That was a good aspect because we hate pharmacology, and it was in part 2. In part 2 also, it was more about dental decks or the MOSB, which was very important for something called as a patient management, which we don't learn in India very often. So that is a subject which you should read. After that, there are so many books. It is ultimately about whether you have understood the concept. In MBD part 2, luckily, more questions are from cons and endo, and I am from cons and endo. It was a bit easier for me, but I had to read everything, and things are pretty easy. They are more clinically relevant. Since the exam is conducted on the computer, so you are reading from the book, but in a computer, the things are different. Appearing for the exam is different. So you have various softwares which you can appear. It costs around 15 to 20,000 rupees. So this is also a big investment, and you will have to do it. The good thing was there is a lot of Facebook groups. People post recent questions. You can go there, read, interact. If you ask help, there are people who will help you. My students, my own students from my institute, and help me when I was appearing for the NBD. It's an amazing experience learning with the students, and that is possible. These are the questions. You can see there can be multiple options. There can be, the first statement is true, second statement is false. Quite challenging. It is very confusing. If you are not very clear with the concepts, it becomes challenging. They also ask you some questions from brain. Circle of Willis is something which I always found difficult during my undergraduation or my entrance exam preparation, but it's a very, very important junction. It's a junction where I believe the internal carotid artery and I think posterior cerebral, I don't remember now, but it has a significance. That's why the question is asked. Okay, not like in India, because I know I've been writing discussions for the Indian entrance exam questions. It is generally asked from a very depth which undergraduate or even postgraduate student may not be able to remember. But here it is very, very important, to remember. Those questions are asked, and case series are also asked like this. Okay, you will have a picture, you will have a perio chart, you will have OPG, you will have IOPS. You have to correlate everything and then come to the answer. For example, you may have a tooth which appears very normal. If you just see the picture, you may think it is normal tooth. But in clinical examination, you should read whether they have done a clinical test, vitality test, where it is negative. If a vitality test is negative and the tooth, although appears normal, without any decay, it is non-vital, then it may be pulp necrosis because of various reasons. So that is how they will test your knowledge. What they want to know is whether you have information with you, you know the clinically relevant things. That is what that matters to them. Okay. Unfortunately, I see students that they don't want to gain knowledge. They are just, more about completing the quota and getting the signature. That is not going to help you. You have to have a holistic approach in your undergraduation, because that is what lacking in India, and it is again reducing, that you don't see the patient, you don't talk to the patient. We are more about, हाँ ये मुझे cavity preparation complete करना है और मुझे sign लेना है. But it is not how one should learn. You should know what you are doing. You talk to the patient, you try to understand, correlate. All that used to happen beautifully during my education. Okay, and it is still happening, but I feel the students should make little bit more effort. Then that exam becomes, these exams or any foreign exam will become easier for you. I appear for another important exam that is called as an ADAT, which is even asked in Canada now. If you want to get admission in one of the top dental schools in the Toronto, and this is a very difficult exam. Okay, it was even difficult for me during that time because there are two sections which are important, which are different than NBD. NBD is just pass or fail, but ADAT gives you scoring because it has biomedical subject, that is basic. Then you have clinical science, then it is data research and interpretation. The problem was I never understood data research interpretation or evidence-based dentistry during that time. But since now I am enrolled in PhD, it is now I have I'm better in this section. But apart from that, that ethics also is there. Ethics also is a very important section, and they are asked in depth. For example, question is like, you are telling the patient that I get the best, I get this crown, so you should also get this crown done. Now this is, you are suggesting, you are sharing your personal experience to the patient, which may affect his judgment. Ideally, it is the patient should decide what he wants, right? So there are tricky questions. In NBD, it is very simple. Like for example, you cannot say no to patients who have hepatitis or HIV. Ideally, you cannot say no to the treatment, and we never do it. The same questions will be asked because they fall under different ethics. There are different ethics like autonomy, you have justice. Okay, so that has to be understood, not just mugged up. You have to understand it. And ADAT is not required for DDS admissions in minority of the US school. Okay, and ADAT is extra. It is limited time. It doesn't happen throughout the year. Another important requirement is TOEFL IBT, which happens in India. You don't have to go to US. This is basically they want to test whether you know English, a proper English. I was from a Kannada medium student. So before going to US, I first thought, let me appear because this is a cheaper exam. And majority of the time you tend to hear this from your engineering friends. Okay, but it's a very simple exam. It is more about practice. Okay, you have to discuss with your wife, your friend, ask them to ask you question. Especially the speaking section requires a lot of practice. There is a very good channel called as Noteful Videos on YouTube, and he has given a very nice way to appear for this exam. So there is this example that such impact continue to pose a natural hazard to life on earth. Now pose can mean anything. You can pose for a picture, but here the pose means it is constantly present there. So it is one of the section. Like for example, this is a reading section, and listening you have to do. It's in speaking, writing. It's a wonderful experience if you are appearing for the foreign exam. And if you ultimately succeed in getting an admission, keeping about the financial thing, it's a very good experience for every student. The expenses for the US, the TOEFL is around 12 to 13,000. Now, please remember that you may have cleared the NBD, you may be a topper in your place, but if you don't have good CV and resume, then you will not be superior to a person who has done better things from you in his undergraduation or post-graduation. For example, postgraduate who is applying along with undergraduate, he will be preferred more generally than an undergraduate because they would have done presentation, they would have done a thesis, they would have done publication. In undergraduation also, these things are possible, but it is bit challenging. So majority of the time people go after undergraduation, do the MPH program, they gain the American experience, and then they go to the DDS. Okay, so all these things, research in participation makes a lot of difference. Undergraduate students are lucky because they have so much of exposure to the world now. And we had very limited teacher to guide us to research and all at undergraduate level. Maybe there are hardly one or two teachers. Now at least teachers are willing, and it's a very good stage to learn all these things, and you should do that. Work experience also makes a lot of difference, and it has to be genuine. Volunteer experience, which you may be doing already, but it has to be documented. Publications do matter. There is something called as SOP, that is statement of purpose. Basically tells you a story about you and why you want to go to United States. Why do you want to get admission in DDS? Okay, and once you do that, you have to, the pass is for residency admission, and majority of the schools now require the INBDE and ECE, and there are deadlines for all this admission process from each school. Apply early, and also note that it is very expensive to do DDS in foreign country, in United States. It is over 1 crore. Majority of the time, students take loan, and if you want to take loan, you need a co-signer or a citizen from United States. So majority of them, they do it. This is a problem for a student who is really brilliant, but financially not stable. So unfortunately, that is a difficult scenario for majority of the good students, but that is how the rule is made for the foreign states, and we have to accept it. If you don't want to do the residency and want to pay less fees and get the do a GPR, that is general practice residency, a 2-year general practice residency allows you to practice dentistry in few states in United States. And I have already made many podcasts on my channel. You can always go and watch it. People who have done this are invited on my channel, and they have shared it. Admission to the DDS, that is Advanced Standing Program, is done by CAPIT application cycle, which opens generally in March, and each school is connected through this CAPIT, and you may have to send the documents again, and each school also will ask you some extra fees for process your application. So it is an expensive affair even before admission. The whole expenses for 2-time journey, giving exam, it all costs around, now it is one exam, so maybe 3 to 4 lakh rupees you will have to spend just before getting a DTS. So just to highlight again, all these books helped me. I was a co-author. My blogs are helpful. I know it's a very difficult situation, but if you have financial freedom and you can achieve this dream, it is possible. Of course, you will have to really put a lot of effort for INBD. So I cleared INBD part 1 and part 2 in just 23 days. I also cleared my ADAT. This is my channel. I request you to visit there. This is my contact information. I'm also on Instagram at Suresh Shenvi. So this was about the DDS. Let me go back, take you to the second presentation for today's event. That is the finishing MDS, in a very meaningful way. Now let me just share my screen again. Okay, is the second slide visible? This new PPT?
Yes, sir.
Okay, so this is going to take very less time because it is like more about important lessons of our life, which I learned not in post-graduation, but after my post-graduation. I always tell my students that your real post-graduation starts after your post-graduation. And whatever I'm going to tell you today is my own experience, my own struggle. And if you are in post-graduation, this can even help you for your DDS admission. Okay, please remember that. These are important points, very less number of slides. So one very important thing which I personally believe, that we should not ask for a stress-free post-graduation. Now, I'm not telling here that we should be harassing our students or it should be extremely stressful. But what I feel is that life after post-graduation, or when you come to a real life scenario, there is a lot of struggle. And if you're not developed a threshold for difficult situation, then handling such difficult situation becomes bit difficult. So if you are a bit stressed out in your post graduation, then don't overthink it. It is normal, and it is going to help you in a long run, because handling stress is very important in your clinical practice. You will meet so many new patients who will having be different kind of expectations, different kind of behavior, a different kind of a pain threshold. So if you have already gone through some amount of stress in your undergraduation or post graduation, it does make you stronger. A stress for studies which can be productive if you are taken in a positive way can be really helpful for all the students, but that doesn't mean that you lose sleep over it. Health is very important. But if a post graduation is challenging, I always feel it is really beneficial in a long run. Second thing is, if you are a postgraduate student, don't restrict yourself for the minimum presentations which is required to appear for a final MDS exam. For example, generally each department will ask you 2 to 3 scientific presentations. I understand if you are financially, it is a very big burden. I had a very less, my parents used to find it difficult to send money to me during my post-graduation. So during that time, if it was difficult for me to attend various conferences. But today I am a speaker. I'm thankful to my department, where our seminar were extempos. We never used to read from the slides. So that's why even you see my screen always tend to have less information and I tend to talk more. If you do more of scientific presentations, it will help you in future to become a good speaker, and it will add up to your CV. It is very important that no matter whether it is a small conference or a big conference, make sure you develop skills for presentation. Okay, but we feel it is a burden for us, and many times we restrict ourselves ki just chalo yaar 2 paper present. I have done that, I am telling you, but I had a reason, and nobody told me during that time that it can even help you for in future for admission processes. But that is very important. Out of luck, I got a lot of opportunities, and today it helped me to develop my skill. But scientific presentations, whenever possible, you should do that. Another important lesson which I learned is that it is not possible to do post-graduation learning dentistry in just 3 years. Okay, trust me, it is not possible. I often hear from people that endo is very easy, hum sab kar lete hain. That is, I as an endodontist, I get depressed looking the international dentists doing such an amazing job, and I see them doing in magnification. Till I moved in magnification loop, I never thought things can be done so differently in practice, like magnification. Once you get used to the magnification, your work will improve, at least in majority of the cases, like restoration, crown cutting. So what happens is, we have a limited vision in our post graduation, is that I will do only these 3 things because that is what is required. Don't do that. Try all treatment modalities, because I'm from a clinical branch. That's why I'm telling you this. If you're in a clinical branch, for example, because if you're in a smaller place, we tend to rely only on a conventional treatment approach. For example, a normal metal crown from a normal lab. But to understand what is quality dentistry, you should also get work done from good labs, and that can be helpful. But you should also try all these zirconia crowns, emax, because if you try it, it becomes easy to understand. The theory is very confusing. I understood ceramic after many years. When you read the ceramic chapter from the Philips, you don't understand anything. I have made a beautiful ceramic video which is over 25,000 views in my channel. It is after many years trying these products, I understood, okay, these are things. And at undergraduate level, at the beginning of post graduation, it becomes difficult. Try it. Give time to learn difficult cases. Now, one thing which I personally believe, that each department should give time to the postgraduates to do special cases, because you may have a lot of case in your department. It regularly happens in endo departments, and you will have a lot of patient, and every patient comes with pain to endo department. But if you want to learn magnification, if you want to do a very good crown cutting, you have to give time, and you have to manage your patients, schedule your patients such a way that you give time to such special cases. You cannot keep one, and you cannot call 5 patients and expect to learn the things in a very nice way. You require time to learn things. So you have to learn to manage your schedule. Good lab is very important. Unless you don't get good work from good labs, you will have no idea what is quality dentistry. Trust me. Okay, and you cannot tell the patient how different you are from any other dentist. Okay, another added advantage is that your lab will teach you what is the mistake from your side, because we all tend to believe that our work is always good. But trust me, the technicians do know what is your mistake. They will tell you this has to be done, that has to be done. During this process, you will learn so many things. Okay, there are beautiful labs available. You should, even a metal crown should, if you get done from a very good lab, you will learn what is quality dentistry, even in your post graduation. So try it, so that when you come to your clinical practice, it can help you to do a quality dentistry. I had loops with me, but it was very difficult. But trust me, at least if you are in prosto, or if you are in cons, I request you that try to buy a loop. Okay, I have Zumax and Z's. Both are good. Zumax, at the cost what you get, it is an amazing lens. If you want overall comfort, then Calzis also is the best one. That can help you to maintain your health, but it takes time. A restoration, what you do at 15-20 minutes. In a loop, it may take 5-10 minutes more. And what work you feel is amazing in a naked eye appears in a different way under loop. So it tells you in a very nice way that how you can work. It is only by looking things closer you will understand how good is your work. You look at the margin of a crown cutting under loop, and your perception of crown cutting changes. That is one thing you should always do. Ask for sponsorship and grant. I did it during my post graduation. I mailed the companies. They sent me material, and I'm thankful to them, because new materials that time was difficult, that it used to come very late to India. But now, fortunately, it is also marketed in the same time when it is launched in foreign countries. But if you ask for grant and sponsorship, that can be a good addition for your CV. Many of the schools or universities consider grant is a very important priority. If you have received a grant, that means that is adds a lot of value to your CV. Publication is boring. Unfortunately, I really hate doing publication because I'm very bad in learning. But if you are good, if you are in a beginning of post graduation, and if you are, many times you don't know that you like doing research, you can enter in foreign countries as a PhD candidate. That can help, that can be easily achieved if you have very good publications. So try to do publication. It takes a lot of time. It is difficult during post-graduation because to manage, at least if you're in clinical branch, to do patients, to do publication, to do research, putting your own money without a grant, it takes a lot of time with added stress on it. But try to do that. It can help you to find a researcher in you. Develop international connections. This was very difficult before, but fortunately now because of social media, you can be in touch with the authors of your book. And trust me, many of the international authors are very humble. They will reply back to you. That doesn't mean that we trouble them, but it is important that you follow these mentors who are very genuine, and many of them are very low, so profile. They maintain very low profile in social media. But if you have doubt, genuine doubt, or you can follow them, they can help you to see things beyond your imagination, right? You may be thinking that you are doing a good job, but maybe they can help you to try something new, to learn something new. In exams also, you can write so many things. For example, gentle wave system, there is something called as gentle wave system, which is popular in United States. Maybe it is not available in textbook 2-3 years, but it was seen in social media, and you can definitely, that can all help you theoretically also. Collaborate with dental industry. This is the last one, I believe. Okay, or one other two. It will see if you develop an ethical relation with dental industry, they can help you to share knowledge with people in your experience, but it has to be ethical, because we should not be mixed up in the business of dental industry. But majority companies try to they always allow the practitioner to be very vocal about their opinion. And if you're associated with those companies, then it will also help you to grow, and they can support you with many of the important milestones of your life. Last few things is try to be good with your colleagues. I know it is very difficult because in post-graduation, you are 3 to 5 students. And if there is some difficulty in going well with them, you end up being isolated. All those things can happen, but you never know who will help you after your post-graduation. So try as much as possible to keep all these politics. I know it is difficult. I have been there. But if you can reduce it, it can, maybe rather than fighting with 3 to 5 colleagues, maybe 1 or 2 should be, sufficient. At least let go things. Try to help them, And last thing is marks. That is something which is very important in post-graduation. Okay. I'm not telling you marks are not important, but unfortunately, sometimes, although you may have done excellent, genuinely, you may have worked very hard in your post-graduation, but the marks may not reflect it, because majority of the time, what we believe as good may not be always good. It is our perception. Okay. Sometimes it depends on the examiner, so many factors. You may end up a class 2 which appears very small in your patient. Before exam, you open it up, it becomes very deep, because radiographically extent is very small and your score may be very less in your final exam. Don't be disappointed. There are a lot of opportunities after your post-graduation to make name, and the same teachers may invite you to share your knowledge. So that is a very simple one stage of your life. It may work out well, may not work out well, but you should always be trying to achieve big in your life. Because when I was a UG student, I never thought I will go to United States. It is like, maybe a poor man's dream. And it was possible during, after my post-graduation. So that was all about my presentation. If you have any questions, I'm always happy to share this with you. So thank you so much for listening to my lecture. Do you have any questions?
Yes, sir. So thank you so much for this such an insightful webinar. People are already loving and this detailed presentation. So we have a few questions if you allow us, sir, so we can proceed.
Please go ahead.
So what is your view on scope of academics jobs after MDS? Should we take, should we not take, and why to take and why not to take? Current scenario.
Okay, let me be very genuine that dentistry is eventually going to be boring if you are completely in clinical practice. That's why no matter in which branch or each field you are, it is always recommended that you take vacations. Okay, there are two aspects here. It's a financial or as an individual perspective. Financially, as you know that the promotions are less, the growth is bit stagnant. That is a calculation which happens in every field. So first 4-5 years, it is really fruitful for everyone because being in academics keeps you in touch with the young generation. It is like, I am in touch with this amazing Cynodent group. I see the enthusiasm. So you can also carry that enthusiasm in learning. So people who genuinely want to teach in academics find it meaningful. Financially, if you have a very good clinical practice, if you are set up, which is running very well, then financially things are different. You may end up earning a lot if you are comparing a beginner in academics and a settled practitioner. Okay, that is there. But satisfaction wise, if you enjoy teaching, okay, then it gives you satisfaction to be in academics. But it is very difficult to balance these two things, right? For an individual things make a lot of difference. For example, dentistry here in India, if you see, your patients really value a quality treatment which is given by you, but you will have to may sacrifice that, you may have to work very hard Saturday, Sunday. In foreign countries, that's why, in India, doctors are valued a lot, they make a lot of difference. In foreign countries also, you have a lot of regulations and legal issues, you have to follow them. But in India, hum log doctor ko bhagwan mante. It is like there are differences, right? In academics, this also. But if you purely financial wise, after 4 to 5 years, you may find it difficult to grow higher. Okay, it depends on various factors. Now, I want to tell you a very important thing here, that if you are watching and if you should read 3 books for your personal growth. One is The Startup of Me, which is a very good book, which can help you to decide whether you want to be in academics or where you want to get, what is in as a growth of an individual. That's a very good book. You should read that. If you want to know how to be happy in life, then Ikigai is the book which helps you, which I'm sure all of you might have read, because for someone money is important, for someone a satisfaction is important. And maybe the third one is a Rich Dad Poor Dad, which if you are stuck in the growth in the academic side or clinical practice, that can help you to decide. So I can't really tell you what is good for an individual, but I'm sharing my experience. I like teaching, but financial also, there is compromise which you may have to do. It depends on individual and which college you are, how many faculties are there in department. But it is challenging in academics. Similarly, it is challenging in clinical practice. But overall, a clinical practice, if everything works out, it is really financially grows a lot. But there are challenges.
Thank you, sir. So the next question is from Dr. Kostov. Sir, any coaching for NBD, is it necessary?
No, coaching is always beneficial. It is like coaching for MDS, coaching for NBD. Now, I really don't know, because I have always learned on my own. That is because I never had so much money to go for coaching, and there was no coaching center during that time. Online just exams were there during that time, online exams. That too, there was only one center. So now fortunately online coaching is also available, but I always believe that knowledge is everywhere. If you want to learn, YouTube is an amazing platform. Okay, I have not gone to United States, but the video I make can help you to appear for the exam and clear it, because it is my experience which is teaching that. There are people who genuinely make an effort. Okay, and if you have coaching, you can take it, but ultimately it is like you are 1,000 students in a coaching institute. Not all 1,000 students will get a rank, right? So ultimately it is your own effort. आप coaching जा रहे हो बोल के आपने अगर effort नहीं किया तो नहीं होगा. Ultimately you have to sit and read for the exam, but it does help you. It can help you. Suppose I tried to teach few students, but then it became very difficult to manage everything, and it job. Coaching has to be someone who has a very good track, same NBD question paper and dental dex copy. Okay, and they give you that and they tell you to read. So I don't think that is going to help you, because all these are free materials which is available on the Facebook groups. But a coaching institute will obviously they will charge you for all those things, because your own research is reduced. Coaching can help if that is a good coaching center, but you can do it on your own, including the visa, the traveling, ticket booking, everything can be done by your own, which I have done on my own.
So any coaching centers that you recommend?
No, I have no recommendation. I don't know, because I have not taken coaching from anyone. It is my friends, my seniors, and the people on Facebook group who help me. My students help me. So that is possible. If you look for help, there are people who will help you, even though they are not from India.
So next question is from Dr. Pradnya. So what according to you is better, DDS or MDS after BDS, taking into consideration that financially the student is well-to-do?
Now this is often asked to me by many students. I never thought it, because nobody told me I can clear NBD exam when I was an undergraduate student. Okay, nobody told me that, and although financially I never thought of it. Now there are two things here which you should know, that with MDS, if you apply for DDS, your chances of getting admission is better. Okay, that is always there. But the problem is you are in India for next 3 years. Visa changes, rules can change. Like for example, COVID happened, and you may have made plans to go to United States, but majority students are stuck in India who are in process. But if you're in US, maybe your process would have continued. So you may get married in India. Okay, if you're in that next 3 years, so you may have that dream, but it is not possible. Your parents may not allow you, or because of various reasons, because family does matter. Or the other advantage is that after BDS, if you go and do an MPH, there are two advantages. One, you get an American degree that is valued more. Your CV gets improved. You will develop experience and connections of the nation where you are going to continue your education. Okay, and taking a decision staying in India is difficult than taking a decision staying in that country, because here what will happen, suppose I have to take a decision, I will have to think so many things that okay, मेरा practice क्या हो जाएगा, मेरा family का क्या है, वो है. But and before entering United States, because it was like a dream for me, I had a perception that it is different than our country. People are different. they are different, but it is like हमें वो लोग मतलब हम लोग उधर जाने के लिए भी चलने के लिए भी हमें 2 बार सोचना पड़ेगा, ऐसा ऐसा परसेप्शन होता है. बट अगर आप वहां पे हो, यू विल रियलाइज दैट इट इज सेम एज majority of the countries, and you can make connections, make better decision, and but the financial is a very big aspect. For example, in you just have to go to exam, that is going to cost you that much. If you don't have a family and you are staying there every day, it is going to cost you a lot. A bread which costs 20 rupees in India, it is 150 rupees in United States if you convert it in Indian currency. Okay, so that you have to make a note of it. But it is always better to be in United States if it is your long-term dream, because you can concentrate on one single aspect without any hindrance. But people also do with an MDS. That is possibility. There is always a star conditions apply.
Thank you so much, sir. So next question is, I think we need to plan another session for all of these questions.
Okay.
So what would be better options after BDS if you do not want to opt for MDS? And what would be immediate first step after passing out MDS from India?
In just India, if you want to settle in India?
Yes, sir.
No, nobody knows their future. Nobody knows where they will shine. Okay. I never thought when I started YouTube channel that people will subscribe to my YouTube channel. Okay. So your luck, your destiny is decided. I believe now you have to work on that. Okay. It's like there is very nice quote which I have heard. The majority of the time, so if you ask कि भगवान से पूछना चाहिए. भगवान से क्यों पूछे? अगर भगवान ने अगर हमारे नसीब में लिखा है कि ये चीज मिलनी चाहिए तो आपको मिलेगी. बट हो सकता है भगवान ने ये भी लिखा हो कि अगर तुम मांगोगे तो मैं दूंगा. Right? It is like that. So I know there is a lot of struggle. So I really can't decide. There are ups and downs in your life in majority of the field. So what is best thing to do after MDS is start working, start doing consultation. If you are financially stable, start putting your clinic. It takes time, nothing like your own clinic, but consultation also is really helps you, because you can learn so much from the senior practitioners. Not just work is a different aspect, but there are practitioners who treat patients so well, and you can learn 1 year, 1.5 years. You should learn after your post graduation under someone. There are 2 advantages. You will also learn how to not to do a clinical practice, and you will also learn how to do a clinical practice. So that can be helpful. There are very good clinical practitioners. I'm blessed to meet some of the practitioners who have helped me, molded me in a good practitioner.
Cannot agree more, sir, because I had my teachers who told me कि क्या करना ये पता होना ज़्यादा ज़रूरी है.
True, so true.
So I very much agreeing to this point. So with this, we come to an end to our question and answer session, sir. I would like to thank from whole of my team, Cynodent. Thank you so much for your valuable time and effort for putting up this wonderful webinar for all of us, sir. I would like to thank my co-host, Dr. Anuvashish ma'am, for accompanying me. I would also like to thank Dr. Anmol Bagaria for setting up this webinar. I would like Dr. Anmol Bagaria ma'am to please conclude this session. Dr. Anmol.
Good evening, everyone who has joined us today for this webinar. I would like to thank Sir for such an informative webinar, Sir. Thank you for sharing all the information. I think it would be very helpful for people who are struggling to decide the things, and it will be better to find a way out. Thank you for your valuable time, sir.
Thank you so much for giving me this opportunity, and thank you, Pratik, Dr. Anmol,
it's our privilege having you
Dr.
here.
Anu. It was wonderful interacting with you, and thank you so much for this platform, which is helping for helping everyone to make good decisions and learn more things in life.
Thanks a lot, sir. Thank you.
Thank you so much, sir.
Sir, if you allow me, I'll end this
Sure,
session
please.
for today.
Thank you. Bye.
Thank you, sir.